Oh well. Oh, okay. Well. Sorry. So, ankles. Someone comes in complaining about pain. Start with history. Ask them what happened. When did it happen? Did you walk here? What kind of pain do you feel? Is it numbness, sharp, shooting, dull, that kind of thing. Ask them if they've ever heard it before, if they've ever had surgery on it before. Ask them to rank the scale 1 to 10 on how much pain they're in. What kind of injury did you, mechanism, and that's basically everything. Previous injury, obviously. After you do a history, you go into palpations. So for the foot and ankle, we palpate medial malleolus, lateral malleolus, peroneal groove, peroneal tendons, subsentaculum tali, which is right here. You go to the sinus tarsi, which is here. You'd go up the tibia. You also go up the fibula. You'd also feel the fibular head. Gastroc, soleus, tibialis anterior. You feel metatarsals. Navicular tuberosity, am I tickling you? Calcaneal tuberosity, calcaneus, Achilles tendon, sesamoid bones, fifth metatarsal, base of the fifth metatarsal, talus, the dome of the talus pops out. Yeah. You appeared in the corner. Go through all that. Once you finish the palpations, you would start. Well, I want to watch them walk real quick, so I'm gonna have them see if they're limping, notice type of movement. If he has an arch in his foot, if it drops when he walks, he can sit back up. That kind of thing. I also check just general plumb line to see if anything in his knees and his hips has to do with what's going on with his ankle. After you finish that, you start with manual muscle testing as the first part. So I have him actively dorsiflex. Other one, do it bilaterally. Relax. Now passively dorsiflex. See if he has any pain with that. Bilaterally. And then I would have him pull up against my hand. See if he has any pain with that. Now actively plantarflex. Okay, now let me do it passively plantarflex. Then I'll have him push down against my hand. Okay. Now invert. Cool. Let me do it. Any pain there? Evert. Cool. Evert, and then I have him push against my hand for resistive push. Okay. I would do a little bit of external rotation, internal rotation, both legs. I would also have him flex his toes and extend his toes. See if there's anything going on with that. After I finish manual muscle, I would go into some special tests. So to rule out a fracture anywhere, I mean not necessarily anywhere, but you could do a bump test, which just smack the bottom of their foot, feel it all the way up, whatever. Also to rule out high ankle sprain, you could do a squeeze test, which would follow all the way up. If any pain with that would be indicative of syndesmotic sprain. You do an anterior drawer, you cup and pull anterior translation of the talus, which helps with ATF. I'd also do tailor tilt, grab. Basically, you're just manipulating the talus to see for the joint laxity. Do bilaterally compare. Do Kleiger's dorsiflexion, any version, which is for also high ankle sprains, so it would push the talus up into his tibiofibular ligament. Alright, now flip over and just this is if you were having posterior. Wow, that hurt.
That did hurt.
Yeah, it sounded like it did. Oh my god, you hurt your foot, I can help. This would be if you he had posterior pain, I would do a Thompson test where you squeeze here and it's supposed to plantar flex his feet. Flip back over. I think that's all the ones I was going to do. And obviously he doesn't have an injury, so I can't narrow anything else down. But that's basically all I would do. Yay! 5 minutes.